It came about because we recognised the supportive care needs, in particular, of oncology patients, so patients who are undergoing treatment in particular, and the lack of access to some of those allied health disciplines. So one of the aims of the project was to provide access for patients to some of those allied health disciplines. Within Bendigo Health, there was a lack of access to occupational therapy and limited access to physiotherapy and exercise physiology, and no ready access to psychology. So that's where we looked at the program actually providing that access, but in a multi-disciplinary way. There were patients that we were seeing within outpatients who needed other sort of input from a psychosocial perspective, not just the physical's perspective. Mm-hmm. And so oncology or cancer patients have not multiple needs because of the complexity of their illness, and it impacts on them in more ways than just the physical. The program itself was a group program, and we did it as a rolling program, so patients could actually access it at different points in time, so that they could actually start at any point and catch up on a session if they missed it at another point in time. At the time that the patients were coming, some of them were undergoing chemotherapy and some of them had finished chemotherapy. So to a large extent, the patients actually learnt from each other what to expect and how things would change over time. So that group format was of benefit to the participants, but also to the facilitators. And there was quite a lot of laughs in that as well. Patients actually really enjoyed the camaraderie and the joking that went on within the group situation. What we noticed for patients was that it was good for them physically. They actually improved or maintained their physical status on the functional measures that we used, and so they noticed that and improved their functional level. But the other thing was that they also found the group format to be really supportive, and they actually really enjoyed that part of it. We also did education as part of the program, so every week there was a different talk, and that sort of looked at different things like coping ability and mechanisms, and return to work. So other sort of issues that were beyond just the physical level of activity or function. Initially we thought it would probably be more of an older age group, but the people who were often impacted on most were people who had been previously high functioning. And so quite a number, as you said, had family at home. They also worked, and so they had other responsibilities and other roles that had been impacted on significantly. So, and the other thing that they often had was chemotherapy-induced peripheral neuropathy. So that actually impacted on them in terms of pain and function. So that was, quite a significant issue for them. We had quite a lot of measures in place, and a lot of those measures were actually to ascertain the needs of the patients, so the rehabilitation needs. So we had functional measures that we did at the pre and post and 6 weeks post the program. And we also had psychological screening measures as well, so we could ascertain what needs the patients had. And as a separate thing in terms of evaluating the program, we actually had weekly questionnaires that where the patients could comment on the content of that program and that talk and how beneficial they found that. So there were quite a lot of measures at different times that the patients had. LMICS actually conducted qualitative interviews as well, where they interviewed patients and got their feedback, and probably that was very useful in terms of giving them broader perspective on the patient's experience. One of the things that they highlighted when they went the qualitative interviews was that the resilience program actually addressed that feeling of being lost and isolated. So that was one of the things that the patients themselves really found that was beneficial, and they very much endorsed that it should continue, and that they found that the biggest benefit was the supportive aspect of being in a group format and sharing that sort of experience with other people who were going through the same things.